Welcome to Mythbusters ADHD Edition. My name is Dr. Kathryn Garforth from Garforth Education.
Hi, my name is Selina Lee. I am the ADHD Whisperer.
We are working together to dispel some common ADHD myths.
ADHD is not a real medical condition. And actually, it is. It is a real medical condition. It's been shown on PET scans or brain scans, and it is that the brain is functioning differently than someone else. And of course, there's a huge range of brain functioning and what's considered typical and atypical or neurodiverse. And this is just one of those conditions that does cause neurodiversity.
Yes, I find it much easier to explain. This is why I like to explain the ADHD, and that's obviously the number one myth. It's a behavior. You choose your behavior. If you have a broken wrist, everyone can see the broken wrist. But they can't see the thoughts in your head. They can't see the brain chemical levels in your head. So saying that it's a physical problem with producing, carrying, transporting those brain chemicals is easier for them to understand that it's beyond your control. It's easier to say that it's physical because otherwise they think, well, the brain, there's your thought, there's your willpower. So why can't you just choose those behaviors?
Yeah, of course. And it's important to know that they probably would if they could, right? It's not intentional. And, they get just as an individual with ADHD that has those impulsive behaviors or the inattentive behaviors, the hyperactive behaviors, it's not that they're doing this intentionally or on purpose. And there are a lot of the times where if they didn't have to, they would have chosen not to if it was an option.
Oh, yeah. I find it quite sad, actually, because you see they have these fights with their brain. They struggle on fighting their own impulses and what they can and can't do and trying really hard to focus when they can't. And everyone's saying, focus, focus, focus. And then when they lose that fight, which is a lot of the time, they get really sad and they get really upset about the potential fallout, and they get remorse and they don't like themselves, and it affects their self-esteem.
Yeah. So it's a huge thing that you really need to take the time and realize that they don't want to be doing this. And, there are some aspects of it that is just who they are. And maybe they're just a person that needs to be really active and live that active lifestyle, and that's fine. But there are other parts that they need support in controlling or having, the ability to pay attention or wait.